Do you have an L4, L5 disc bulge or an L5, S1 disc bulge or herniation? Can sciatica or leg pain be caused from a disc herniation? Today I'm going to explain what sciatica is and can it be caused from a disc herniation, and I'm going to give you some tips to help you. I'm Dr. Gregory Kramer, certified chiropractor in Livonia, Michigan. I've been helping people get out of pain, stabilize their spine, avoid spinal surgery so they can live stronger longer for the last 30 years. Now today we're going to talk about sciatica, which is leg pain. And I'm also going to give you some tips on if your sciatica is caused from a herniated disc. I'm going to give you some tips on how to help yourself. Now, one of my viewers asked a question, and this is, I take my hat off to you, the Poppy 74. It talks about, he asked, I have sciatic pain and it's better when I'm in flexion, worse when I'm in extension. What can I do to help it? So I'll be covering that. Remember, if you like this information, do me a favor. Click to subscribe, like it and share it with some friends that you think would help them, and also ring the bell. That way every week, I'm going to try to get a video out every week, every 2 weeks, that will help you. Also, please let me know. I've changed my uniform. I'm not wearing scrubs. Today, this is my son's football team. I'm in Livonia, Michigan. This is the Lakes Area Hawks. Also, my daughter is a cheerleader for the Hawks football. So I'm going to start wearing this. If you guys like this jersey, this is to support the Lakes Area Hawks football and Lakes Area Hawks cheerleading. If you like it better than the scrubs that I normally wear, hey, just let me know. I want to hear some feedback for you. Also, don't forget, answer any questions you got, shoot them out. That way I can help you with it. So let's talk about sciatica. So when we injure the disc, see this red mark? That's a tear. Could be an annular tear. So the inner part of the disc can ooze out. You see that oozing? That's a herniation. This is the nucleus sucking back in. This is a herniation, and it can irritate this nerve in the low back. Those are the sciatic nerves. Decompression sucks it back in. This is a herniation, irritating the nerve. Incredibly painful, incredibly inflammatory. So in the low back, there's a group of nerves that form the sciatic nerve. So you will see in this model, the spinal nerve distribution, these nerves in the low back will form a large nerve, which I outlined in red, a sciatic nerve. And that can run all the way down the back or the side of your leg. So it's a group of nerves that can get pinched or stretched. And these nerves are really, really sensitive. And the further the pain goes down your leg, the worse your situation is. Remember, I've talked about it before. Everything we do should centralize the pain. So in this diagram, the pain goes all the way down to the foot. Well, if treatment, exercise, spinal decompression, pain relieving positions causes this pain to go up higher, that's going in the right direction. So you got foot pain. As you start to get calf only, that's better. When the calf clears up and you only got thigh, that's better. When you only have buttocks pain and no leg pain, that's better. And eventually you'll have just axial pain. In other words, the pain is just around the spine. So anything that makes your pain travel further from the spine is bad. Anything that causes the pain to centralize or get so closer to the spine is good. Now, again, the pain can go in the back of your thigh. It can go in the front. Let me show you on another picture. Now, this pain is rating, you can see there are numbers, L2, L1, L3, L4, L5. It's not in an exact, so there's a lot of inflammation. So you could have a L4 disc that gets so inflamed that can hit an L3 nerve root. This is where my pain was. It was on the inside of my leg. And the muscles right here in my leg got a little bit smaller because these nerves were getting pinched. I'm 6 months, almost 6 months out from my disc herniation, and I'm doing fantastic. I'm training, but we're going to talk a little bit about sciatica. All right. So again, depends what part of the nerve. You can have the pain go down the S1 nerve, and this is where you'll feel it. You can have the pain go along the L5 nerve, and that's where you feel it. If you look at you on the side, if you feel it in the L4 nerve, this is where you'd feel it. This would be L5, and then this would be S1. So it depends how much inflammation, and sometimes there's so much inflammation, it can override a couple nerve roots. So sciatica can be caused from a variety of factors, all right? The most rare would be a tumor. It's possible, not very common. So if your sciatica is not getting better fast, I would definitely get some images right away, particularly an MRI. Sciatica can also be caused from a bone being misaligned, more probable than not. Sciatica can also be caused from a herniated disc. Sciatica can also be caused from a bone spur. So if you look in this model right here, this one, there's lots of room for this nerve. However, this one, you'll see these rough bones, that's degeneration. These are bone spurs. You'll see a thin disc and rough bones. That's the hallmark sign of degenerative joint disease. Now, if we look at this one, the bones are nice and smooth, the disc is fat, lots of room for that nerve in this hole. So we want big holes, so there's lots of room for the nerves. So in this case, sometimes the degeneration makes the hole smaller. So it doesn't take much of a misalignment to pinch the nerve. So again, the more room you have between the vertebrae, the greater you can have a misalignment without it causing a big problem. But as you lose room, because the disc gets thinner, we're talking about the top to bottom. So this is vertebrae, this is bone, this is a fat disc, this is a thin disc with a rough bone. There's less room for error. So a misalignment of the spine can cause sciatica. So there are many things that can cause sciatica. And sometimes you can have a combination. You've got a misalignment, you have a bulging disc, you've got a bone spur. So there's a number of factors. Sometimes you can have a tight muscle in the piriformis, which is the muscle underneath your glute or butt muscle. So there's lots of factors. The most common cause of sciatica is either a disc problem, a space occupying lesion. The disc actually takes up space and it puts pressure on the sciatic nerve. And it's not just direct pressure, there's tremendous amount of inflammation. So fluids, believe it or not, could create tremendous pressure on the nerve. And I talked about that, I believe, in my previous video, that if your sciatica or if your back pain is not getting better with the tips that I show you with exercise, you would be a good candidate to find someone to do a measurement on your spine, someone who is a certified corrective care chiropractor that can measure your spine and see, is there a displacement? Also, you may need to get an MRI to see, do you have a disc herniation? So you can have a combination, a disc herniation and a spinal misalignment. And the beautiful thing of non-surgical spinal decompression is, as you decompress the spine, you are kind of pumping fluids in and out, and that feels great, let me tell you. Not only am I a treater and a provider for disc problems, I am also a client. And I've had it done to me, and I still have it done to me, and that I credit that to the success of my recovery. I had a huge, this is me here, that's a huge disc herniation, and I'm working out, lifting weights, running, I'm able to do martial arts, so I'm very thankful I'm in the place. And if I can get through this, and I was so bad that I had to be knocked unconscious to get an MRI, if I can get through it, so can you. All right, now remember, if you like this information, click the bell, like and subscribe, share with a friend, that way I can help other people. Also, tell me, what have you done? So if you have sciatica and it's pain going down the leg and you have found things that have helped, why don't you post that, share that, so that we all can learn from it, all right? So today, the Poppy 74 talks about that for him, flexion feels better. Flexion is when we bend forward. Okay, flexion is when we take the spine and we bend forward. Our body would look like this. For a lot of people, flexion is worse, but for many, flexion was better. For me, it was better. So the biggest thing I would say is if flexion helps you, then I'm going to show you a couple tips. And I don't know your individual history. However, very commonly, if the back of the spine, those vertebrae are misaligned, or if the disc is bulging and flexion helps, then I would continue doing it. Okay, so flexion exercise. So I'm going to show you 3 easy flexion exercises you could do if flexion helps you. So the first one is very simple. It says you're just sitting, you squeeze your abdominals, and you go forward. If that feels good to you, then do it. Usually, this would be for an older person, usually over the age of 50. Usually, they will have some thinning of the disc. So in addition to a disc herniation, they're going to have probably some arthritis. It's usually over 40 or 50 years old. This usually will feel good. If that feels good, if it causes your pain to centralize. Now, centralize, that means that your pain goes from your foot closer to the center of your spine. I would do it several times a day. If this causes either back pain or causing the pain to radiate down your leg, then I would avoid it. All right, so this is a simple exercise that you can do. The other thing you can do is do some traction or decompression of your spine. Now granted, this is not the same as coming into a doctor's office that does spinal decompression. However, this can give you some temporary relief. And this is what I did in my house. In fact, I almost had to sleep like this for about a week. Let me show you. This was one of my favorites. In fact, like I said, when I was in agony and I was getting spinal decompression done, I was in such pain, I couldn't sit or stand. In fact, when I went to my chiropractor's office to have spinal decompression, I would bring my ball with me, believe it or not, so that I'm lying on the waiting room. That was the only position comfortable. And believe it or not, when I went into the hospital to get an MRI, even when I was on some pretty strong drugs, and I have a natural outlook, I never take drugs for anything. However, let me tell you, they tried everything. When I was in the hospital, they tried something called a spine bomb. It took the edge off, but yet I still couldn't lie down without any pain. And I was so uncomfortable. Thank God I brought my football with me. However, the funny thing is when I had to stay overnight in the hospital, I was afraid my football was going to run out of air. So, believe it or not, in the hospital, they don't have another ball. All these millions of dollars of equipment, I couldn't lie on my side, on my stomach, on my back. So, I had my wife get me a second ball just in case this popped. That's how uncomfortable it was. So, whenever I was being transported on a gurney, I always had to be face down. So, the moral of the story is do whatever position is comfortable for you. And if lying face on a football, bring it with you to your doctor's office. Bring it with you to your hospital. Bring it with you to the MRI. Like I said, I could not stand for more than a minute or two. I was in bad shape. So when you put a football on an elevated surface, for some of you, this is going to feel like heaven. So I recommend on a bed, but you got to be able to hang on to something because I'm going to traction the weight, and you got to be able to relax. The key is you got to get the weight of your feet be a traction. So for some of you, test just lying on your ball. Okay, this might feel really good to you. If this feels good, then reach down, get a hold of something. And now, the weight of my feet feels really good on my spine. And I can kind of pull with my arms and feel what position is the best. If it's too much for you, if you're in acute pain, then maybe just let your tippy toes capture this. But I did this several times. And then if I had to get up and go to the bathroom, by the time I got done going to the bathroom, I would get back on a ball. Now, if this is too much, if the weight of your feet is too much, again, I don't know if you're an acute disc problem or you have a chronic. If you're a chronic, this would probably feel great to you. Do it several times a day and build up your time. I recommend 3 to 10 times a day. So maybe a couple minutes in the morning, noon, and at night. So if you're in an acute situation, you might need to do it every hour. So this is a great tool, but if that's too much, perhaps you need to just do it on the floor. So for some of you, that might be too much. Again, perhaps you can't hold your body weight. Perhaps you have nothing to hold on to. So for some, just get on the floor and you can roll, and while it's not as powerful, you still can feel a decompression, getting your knees off the ground, and roll around and try to relax. Try to do 10 deep breaths and really let your spine elongate. For most of you, this will feel good. And eventually, you could go from the floor to this on an elevated surface so your feet can hang over. This feels really good. That is probably one of the best things that you can do. Now, we talked about how you can sit and flex. We talked about how you can do the football elevated without your feet hanging. And then you can also do it where the football is on the floor and it's more of a mild stretch, more of a mild decompression. I do not recommend touching your toes while we stand because it's a little bit harder on your back, okay? Those are the best exercises, the best positions if you have sciatic pain, and it's better when we flex forward, okay? The other thing you might want to test, if you're strong enough and you're not in an acute situation, is sitting in a deep squat. So here my back is straight, but here my back is rounded. For some of you, just spending time in a deep squat throughout the day. And some of you might need to hang on to something because you don't have the flexibility. So what you can do is you can open up a door and you can hold on to the edge of it, and you can test whether a straight spine feels better or a rounded spine. You can test whether your feet are close together or wide. Usually throughout the day, spending time in a deep squat, pushing your knees out, feels really good for people when they have sciatica that's worse when they lean back, or sciatica that's better when they flex. So the squatting, the sitting and bending, lying on the ball, those are probably my best recommendations for you. So to summarize, sciatica most commonly can cause from a disc bulge or from a misalignment of the spine. Those are probably the two most common. You determine a misalignment on the spine by an x-ray from a certified corrective care chiropractor. Probably the easiest way to find a good corrective care chiropractor is go to idealspine.com and find someone that's at least basic certified by CBP or chiropractic biophysics. Also, many certified corrective care chiropractors can offer spinal decompression if you need that. Okay, we offer that here in Livonia, Michigan. I'm Dr. Gregory Kramer, corrective care chiropractor in Livonia, Michigan. Please let me know which of these exercises, which of these positions, whether it's the squatting, let me know if squatting feels better, lying on the ball on the floor, or lying on the ball on an elevated surface. Let me know one of those three feels better for your back and sciatica. So one more time, either squatting deep, lying on a ball on an elevated surface like a bed, or lying on the ball on the floor. Please comment and let me know which of those feel better. Also, let me know if you like my new, I'm gonna try to wear this every time I make a video. This is to support the Michigan Hawks, it's called Lakes Area Hawks football and cheer. That's where my kids are. I want to support them. So if you guys like this, I'll wear this instead of scrubs. And remember, if you know someone that's suffering, send them these videos so we can help them. Just like it and share it and subscribe and ring the bell. We appreciate it. and comment on what helps you, comment on what exercise you like, and I'll see you on the next video. And if you want other videos, this video over here is going to be of a big service, and I would watch that video next.